You're not lazy. You've tried cutting out carbs, going to the gym, taking birth control, but nothing is changing. That's because you've been healing the wrong problem. Let's talk about the myths that are keeping you stuck with PCOS, polycystic ovary syndrome. Hi everyone, I'm Dr. Natalie Caitlin, a sexual and reproductive health doctor, and today we're busting some of the most common PCOS myths that keep women stuck, misinformed, and frustrated. Whether you've just been diagnosed or you have been trying to fix your hormones for years, by the end of this video, you'll finally understand what's really going on. Myth number 1. PCOS means that you can't get pregnant. Many women with PCOS conceive naturally or with support once hormones and ovulation are restored. Why? Because the issue isn't infertility, it's ovulation irregularity. In PCOS, because of the mismatch in hormones, many women don't actually ovulate regularly. And when you don't ovulate regularly, getting pregnant naturally becomes difficult. But with the right guidance, lifestyle changes, and treatment strategies, many women have restored ovulation and conceived twins even. Myth number 2, if you lose weight, your PCOS will disappear. Weight can influence symptoms, but PCOS is not caused by being overweight. It's an endocrine disorder, meaning that hormones drive the symptoms, not just the number on the scale. Insulin, cortisol, inflammation, those are the things that you actually need to fix to clear your symptoms, not just chasing numbers on the scale. By the way, a lot of skinny girls and women with normal BMIs and healthy weight also have PCOS. And this actually brings me to myth number 3, that PCOS only affects overweight women. 20 to 30% of women with PCOS actually have normal weight. It's called lean PCOS. Despite having normal weight, these women still have insulin resistance, acne, fertility issues, which is why it's very important to understand that PCOS is not about the weight. It's about understanding the driving factors. Again, insulin, cortisol, inflammation, among many others. Myth number 4, birth control is the treatment. This one drives me crazy. Honestly, it just does. And I'm always happy to see people finally speak about it. The reason doctors prescribe the pill for PCOS is to regulate bleeding. Because when you go for months on end without shedding your uterus lining, something called endometrial hyperplasia can happen, which is basically where your uterine cells turn into cancer cells. So to avoid this happening, you're put on the pill and you bleed monthly. But remember, this isn't your actual hormones causing you to bleed. It's a withdrawal bleed. Using the pill without any long-term lifestyle changes or true healing that focuses on the root causes of PCOS will not help you in the long run. It just delays your healing. Myth number 5. You must cut out all carbs and sugar. Guys, you don't need to fear food. The goal is balance. Choosing complex carbs, high fiber foods, and pairing them with protein and healthy fats. Extreme restriction often worsens cravings, stress, and cortisol, all of which affect your hormones. Myth number 6. PCOS always causes irregular periods. Some women with PCOS still bleed monthly, but not all bleeds actually mean that you're ovulating regularly. Regular periods don't always mean balanced hormones, and that is why lab tests and ultrasound are part of the key points for diagnosing PCOS. If you watched my PCOS series that I did recently, you'll remember that I shared the diagnostic criteria that we use to actually diagnose PCOS, as well as the tests that we do to actually confirm it. Myth number 7, if you don't want kids now, then you don't need to treat it. PCOS is not about fertility. It's about your metabolic health and your endocrine health. Remember, when you leave PCOS alone and do nothing about it, it increases your risk of diabetes, high cholesterol, and endometrial issues later on. I already talked about how endometrial cancer develops from PCOS. The earlier you manage PCOS, the healthier you feel long term. Actually, I always tell my patients that don't set your goal for managing PCOS as getting pregnant only. Your goal should be to reverse your symptoms so that you can lead a healthy life and avoid all these other complications like heart disease, infertility, and endometrial cancer. Myth number 8. If your ultrasound is normal, then that means you don't have PCOS. Again, if you missed the PCOS series, you really need to watch it because I shared in detail how we actually diagnose PCOS. You don't actually have to have cysts or PCOS type ovaries on ultrasound to have the diagnosis of PCOS. As long as you have irregular ovulation and clinical or lab signs of hyperandrogenism, you have PCOS. So what does that mean? Simply put, a woman might not have the visual features of PCOS on an ultrasound, but they have a beard, or they have really hairy arms, really hairy chest, hair on the belly button, and their period has become irregular over time. That woman has PCOS, even if her ultrasound doesn't show it. Ultrasound is not the only thing that is diagnostic of PCOS. Myth number 9: you only need to treat PCOS with medication. Medication can help, but it's part of a bigger puzzle, which is exercise, nutrition, sleep, stress management. All of these things have a hormonal impact. Healing PCOS requires a lifestyle approach, not just a prescription. I did an entire video on this, and I will leave it on the screen here, as well as in the description box and at the end of the video, so that you guys can go and watch it. But finally, myth number 10: once your symptoms improve, then you're cured. PCOS is not something that you cure. It's something that you manage. When your hormones are balanced, your body feels better, but consistency is key. There is no point in reversing your symptoms and then going back and raising your insulin and glucose levels again. You can absolutely live symptom-free with the right habits and care. In conclusion, healing from PCOS is not about perfection. It's about understanding your body and giving it what it needs. I really hope this video helped you to rethink what you've been told. Please share it with another one who needs to hear it. And if you're not sure where you stand, do you have PCOS? Is it just something else that's going on? Visit your doctor and have a full checkup done. Certainly one that includes your insulin resistance levels, because remember, in reproductive health, knowledge is power. What you don't know can hurt you. Also, I do have discount codes and packages for PCOS tests for women in Tanzania. Feel free to reach out to me if you need this. You can DM me on Instagram or comment below. You can also check the description box below for more details on these packages. Please subscribe to my channel if you haven't already, and let me know what topic you'd like me to unpack next. See you in my next one.